Well, Brian, thank you so much for finding the time to talk with me. You've got big news. You're leaving as CEO and going back to the lab and the clinic.
Yes, I'm going back to where I started. It's kind of nice.
To set the record straight here, 18 years is an amazingly long time.
It has been an incredible run, Paul. And what I've always said is that I feel like I've changed jobs every 10 years. And for the first 10 years, I ran a small to medium-sized cancer center. And for the last 7 or 8 years, I've ran a medium to large cancer center. And they're very different challenges, very different opportunities. And I'm just so grateful for the opportunity that I've had over the last 18 years.
Well, as I do the kind of back of the envelope calculation, over 50 years, I don't think there are 12 cancer center directors who have done 18 years or longer. It's a
Well,
very small number.
I'm honored to be in that group. And as I said, I think if I look at the what we've done at OHSU Knight Cancer Institute, I'm again extremely proud of what we've built here. And I would hope I don't know how many other centers have grown as much as we have, and even have has as much of an impact as we have over these past 18 years.
Actually, going back, since we're going to do a little bit of a retrospective, 1993, you emigrated to Oregon from Harvard, from Dana-Farber. What was there? How did this idea of starting a comprehensive or starting a cancer center, NCI designated cancer center, how did that evolve?
In 1992 or 1993, the president of OHSU, Dr. Peter Kohler, approached Dr. Grover Bagby, who was the founding director of what was then the OHSU Cancer Center, and said, "We want you, I want you to build an NCI designated cancer center here." And Grover, who was actually looking potentially to leave OHSU, took up that challenge. One of his first recruits in 1993 was me.
Mhm.
And Grover had a vision of building an NCI designated center. He, I saw in OHSU a place where there was limitless possibilities, an entrepreneurial spirit. And I had a project that was kind of going against the grain. And that was to kill cancer cells without harming normal cells. And at the time, everybody wrote about it. Nobody had done it. And a lot of people were starting to believe it was never going to happen, including people at Dana-Farber Cancer Institute. So with that in mind, I set out to Oregon, and within 6 weeks, I had compounds in my lab that were killing CML cells, chronic myeloid leukemia cells, without harming normal cells, and that drug became Gleevec.
But actually, I think there's one bit, since we're really getting off subject. Uh,
Yes.
well, maybe we're not. I think there was also the tidbit that your grant with NCI was for biology of CML rather than fighting
Oh,
CML with a drug.
oh, absolutely. And in those days, the NCI would never have funded a translational research project. And so my first RO1, which I got in I think 93, 94, was on basic signaling of BCR-ABL, uh, looking at substrates of the activated tyrosine kinase and looking at mechanism of transformation. And that was mainstream science in those days, and that's what I was doing in the laboratory. But I also had this side project trying to kill CML cells with drugs that targeted the BCR-ABL tyrosine kinase. And again, that was not something the NCI would fund.
So you were kind of diverting resources a little bit.
A, a
Glad you
little bit.
did.
I was using some of my startup funds. I had a very small ACS grant. And in 1996, I got a Leukemia Lymphoma Society Translational Research Award. That was a program they started that year. And I remember looking at the grant when that came out and said, they must know what I'm doing because they were looking to fund projects where people are working on drugs in the lab that might get to clinical trials in 2 or 3 years. That fit me perfectly.
Looking just skipping and jumping a little bit, what caused you to decide to go back to the lab now and lab in the clinic? Uh,
Yeah.
was there how is there an anatomy of that decision, or was it just a flash?
It's something I've been considering for quite some time as I transitioned from director to Knight CEO. I've it was clear that I've got a great team behind me. I've got Tom Sellers, who's been in this role at Moffitt, has been deputy director at other cancer centers. I've got an incredibly experienced director. I have two deputy directors, Shivani Kumar, who is building a phase 1 program, Lisa Cousins, who's built an incredible tumor microenvironment program, Gordon Mills, who's been running our precision oncology program, and Sadek Esner, who's running our early detection program. I have a great leadership team. And what I was doing was more on the clinical enterprise and helping to build out our clinical programs. And in a big bureaucratic institution, that can be really hard. And I just recognized that I was spending my time on bureaucracy, not on the things, not on making a big impact against cancer. And because of that, I just began to realize I want to get back to doing something that was big, bold, had an impact. And the best way to do that was to return to my roots.
Mm-hmm, mm-hmm, mm-hmm. So this built up. So I guess last time we talked was when you split up the job into two. Uh,
Yes,
and was this a part of it? Is this part of the continuum?
it was part of the continuum. It was something where again, I knew that I we always had sustainable plans for the Knight Cancer Institute, and it's growing, it's thriving, it's doing well. And so I recognized that I could step away from it and do other things, including helping the institution at OHSU build out its clinical enterprise. But as I began doing that, I realized part of my stepping away from being the director was I wanted to get away from day-to-day operations. I was doing even more day-to-day operations again.
Oh
And
my
I really wanted to be doing something where I was making a bigger impact.
God. And that for you is the lab and the clinic.
For now, yes, yes.
Fantastic. So there was not, is this in any way connected with legacy merger? Do you care about it much?
Oh, I care deeply about the legacy merger, and part of the undercurrent, as you saw from the note that I wrote, was OHSU leadership hasn't set a vision for what they want OHSU to be or for what the legacy OHSU combined entity to be. And I think that it could be a great thing for the community to extend the reach of OHSU into a much broader community and to provide high quality care. And the reality is, Paul, for the last decade, we've actually had a collaborative relationship with Legacy in delivering oncology care. So all the medical oncologists at Legacy sites, and there are 5 of them in the Portland metro area, are OHSU medical oncologists. And it's again a growing, thriving enterprise where the same quality of care is delivered across the entire Portland metro area for oncology patients. That's what I see as the vision for what we can do with this OHSU legacy merger, but that needs to be communicated to the community and to the state. And that has to be done by OHSU leadership.
And this has not happened yet.
It has not, no.
No. Oh, wow. So is this a part of your decision or
It
no?
was again, that was just part of what I was doing and stepping away was we need and OHSU needs their leadership to set a vision, set a strategy, and you take, the reality, as you know, healthcare right now is a really difficult place to be. And our costs have gone up, our revenue has stayed pretty flat. And that means that OHSU is losing money, Legacy is losing money. And when you combine two institutions that are losing money, you need both leadership and strategy to get both institutions on track. And that's going to be, I see it as an incredible opportunity, but a huge challenge as well.
So instead, you just decided to do something easy and cure cancer.
Yeah, exactly. Yes, exactly.
That's fascinating. What about impact on your CCSG? It's coming up in 2027, right?
Uh, we submit in, let's see, I think it's May of 2026.
Right.
Yes. So yes,
So,
the renewal will come through in 2027. Again, as I said earlier, Paul, we have the Knight Cancer Institute is well funded. We have substantial philanthropy. We have a great team, great programs, and I'm confident that we're not only going to be renewed, but we'll be renewed with a better score. And there's a couple of things that we've done. Over a decade ago, we set up a program that we called one of our four programs was quantitative oncology. And we have a great external advisory board, but our external advisory board was confused. What's quantitative oncology? And although it was kind of hard to explain, I just made it pretty simple and said, this is about big data. But
mhm.
what I really meant and what our team really meant, and this was built by Joe Gray, was this is about developing algorithms to analyze all the masses of data that we're generating. Well, fast forward 10 years, and you think about artificial intelligence and all the computational biology investment that every cancer center is making. That was what we did a decade ago. The other thing we did in our renewal two times ago was we had built a community partnership program. And we, over the last decade, we put $1 million a year into our communities, asking them, what are your needs for cancer prevention, control, and management of your cancer patients in your community? The reviewers of our CCSG 2 cycles ago loved that so much that that became the template for community outreach and engagement that now is required for every cancer center. So I look at where we are and what our center has done is we've pioneered many of the requirements for CCSG, and we've always been on the leading edge of what centers aren't required to do. So I'm confident that we'll do incredibly well.
So everything is that part. You're not a PI, so I'm not even sure they need to replace you.
No, no, I'm not the PI. They do not need to replace me. That again, that was part of what I wanted to make sure is that as we went into this renewal, we had somebody that is really good at this task and is going to make sure that we get even a better score than we did last time. And I'm confident that we will.
Oh yeah, you've got quite a team. I guess I might as well ask you since you're leaving, and everybody else seems to be really worried about this and not necessarily willing to discuss it. Right now, COE, DEI, Surtec, all of that may
Yeah.
be causing, maybe in trouble because of the Trump administration.
Yes.
It's that what's your strategy for keeping that going, or or would you allow it to fall by the wayside? What happens if it does?
Um, I will state very plainly, Paul, that we will always do what's right. It is critically important that we engage our communities, that we continue this community partnership program that has been beloved by every county, all 36 counties across the state of Oregon, where we're putting resources in the community to help them get better care, better screening, and better management of patients with cancer. We firmly believe in that. We believe in training the next generation of cancer researchers, clinical researchers, and individuals who are caring for patients with cancer. That's Surtec. And we also firmly believe that having a diverse workforce helps everybody in our state, at our cancer center, And we are firmly committed and have been firmly committed for well over as long as I've been director at diversifying our workforce. And we will continue to do that.
Well, Florida and Texas have made this illegal, basically. Uh, so
Yeah.
would you do it if it becomes an unfunded mandate?
We have been doing this as even when it was an unfunded mandate, and we will continue to do that. It may be that we'll have to put a different name on it, but it will be the same thing, which is we know that a diverse workforce does better.
Oh,
And
that.
whether that's diversity of disciplines, diversity of race, ethnicity, ensuring, and one of the things that we've done is I have more women in leadership than any other cancer center. I think 75% of my senior leaders are women, and I'm extremely proud of that.
hmm Wow. So I guess what I'm wondering about is what happens next in Washington. You may recall there's this routine we went through really ever since Klausner. Whenever the NCI director's job became open, I would call you and say, they offered, and you say, yes, they have. And did you say yes? You said no. I said no. And that happened how many times do you think?
Oh, I think it's been at least three, maybe four.
Why didn't you ever take that job?
Well, there were many factors, Paul. And first of all, during many of those times when I was asked, we were in the critical growth phase of the OHSU Knight Cancer Institute, and I wanted to see that through. There are also some family considerations. I had younger children, and uprooting them from Portland may not have been the best thing for them at that time. But ultimately, I felt that I could have a bigger impact by building a quantitative oncology program, by building a tumor microenvironment program with Lisa Cousins, by building an early cancer detection program that 10 years ago, nobody had early detection. Very few had early detection programs, but now everybody does. So again, there were just things I thought I could do here that would have a big impact. And yes, it was honored and humbling to be considered for NCI director. And there were certainly lots of things I thought about that I would do and could do in that role. But as we're hearing the undercurrent here, bureaucracy isn't necessarily my strong suit or my passion. And it's really all about curing cancer. And I felt that I could do more work and have a bigger impact by staying in the job that I was doing here.
hmm hmm how much money have the Knights given you? Have you discussed this change with them?
Yeah. And over my tenure as cancer director, they've given upwards of $600 million in in philanthropic funds. And I've absolutely been discussing this change in role with the Knights over the past few months as I was considering this because I wanted them to be aware that at some point at some point I was going to retire anyway, and they knew that. Uh, but we had always set this up to be sustainable. From day one, when we started spending their money, we presented sustainability plans. So when their last pledge payment was given, which will be in 2027, we will be able to sustain that investment. And I've made that very clear, and they're very proud of what we've built here. One of the things that they benefit from is people actually send Phil and Penny Knight notes of thanks. Thank you for what the care I got at the OHSU Knight Cancer Institute. Thank you for bringing this program to the state of Oregon. They read those notes, they appreciate those notes, and they are incredibly grateful for what they've helped build here.
Actually, 600 million, correct me if I'm wrong, 500 of it was matching funds, so it's 1.1 billion, right?
Yes, it is.
Wow. Yeah. So you've been for somebody who doesn't like all of the administrative stuff, you've been pretty good at raising money.
Well, the fundraising is actually fun. And because I never ask anybody for money. I just talk about the great work we're doing and the great work we want to do. And if people are willing to get behind that, I've got a development officer coming behind and saying, would you like to support Brian's vision? So it was an easy job. I get to be a scientist talking about the science and the great work.
Does Tom get to do that now, or who does it?
Tom and Tom will get to do that. As Tom knows, I'm always there to help him, but mostly I what I don't want to do is I don't want to get in his way. And
Yeah.
one of the things that Grover Bagme taught me when we transitioned from Grover to me was the best thing that he can do is get out of my way and not micromanage or look over my shoulder. And that's certainly my plan with Tom. I will always be there to support him, always be there to help him, but he needs to lead.
So I guess the most important question is what's next? That's where I should have probably started.
Oh, well, uh, part of part of this, well, the important news is my daughter Julie, who's graduating from Northeastern in May. She and I are training to run the Boston Marathon as part of the Leukemia and Lymphoma Society team in training. So one of the things that I will be doing is I will be ramping up my running. And on my long runs, I'm going to be thinking about, as I always have, what is it that I really want to do next? Where can I have the biggest impact? And yeah, I've been thinking about lots of potential projects, certainly in my own laboratory. CML is now a manageable condition, but not cured. And why not? What is it about those residual leukemia cells that we can't kill so that people can stop therapy? But that's also a paradigm for residual disease in many cancers and leukemias. What is it about those residual cells that allows them to evade therapy and then ultimately come back if we don't continue to treat a patient's cancer? So there may be something about cancer stem cells or persistent cells or the tumor microenvironment. I think there's a remarkable project there. I've talked a lot about patients navigating their cancer care experience, and there may be some opportunities there. And there may also be some opportunities to expand what we're doing with community outreach and engagement and thinking more about public health. The best way to manage cancer, we already know that we could prevent 1/3 of cancer deaths with prevention, getting people not to smoke or to stop smoking, HPV vaccines, all the screening technologies. So there may be some opportunities in public health to improve the health of Oregonians. And so those are some of the big things I'm thinking about, and we'll see where I land.
Hmm, hmm. So interesting that you're heading towards public health, because that's not been your, well,
It's
you've done
it,
it, you've addressed it as the center director, but
yes,
scientist
but
now.
as what we've learned during the pandemic is that our disinvestment in public health over the last century actually made matters worse. And if you think about the president's cancer panel over the last 20 years has very clearly stated 1/3 of cancers are preventable. And so maybe there are ways that we can think about. I was actually just interviewing a candidate who was talking about how we get into our communities, how we do a better job of getting people to do our many of our disengaged people in our communities. How do we reach them? How do we ensure that we have more public or community health workers that are looking out for the health of people in their communities? These are solvable problems, but are going to require investments both from states, from cancer centers, from philanthropy, from businesses. And this is something that's a tractable problem, but maybe it needs some focus and attention. And again, I'm not saying that's what I'm going to do, but it's one of the things that's been rattling around.
But that's more of an activist job, really, to some extent, right?
Sure, but I've always been an activist.
Of course, of course. Well, I'm just speaking of which, um, this at this time, this field needs to be led by really not just by the NCI director, who may not be in the position to lead, but there has to be more of a transition to a societal kind of
Now,
leadership. community.
That's ex
How
that's
do we
exactly
do
right.
that?
Right.
And I
And
mean,
again,
we, please.
I mean, right. And when I look at the state of Oregon, which is 4 million people, it could be a tractable and with a history of a governor, John Kitzhaber, who is a physician, who actually set up uh, the Oregon Health Plan long before Obamacare. And we have a history in Oregon of doing innovative things in healthcare. And there may be an opportunity. We have a governor, uh, Governor Tina Kotek, who has talked who's talked in her own budget about improving mental health care in Oregon and made that a priority. So there's already potential in Oregon where the state is looking at this. There may be other opportunities because we have incredible leadership and a history of tackling these big problems and doing innovative work. Again, I think as a more of an activist, as a convener, as a thinker, if there's ways that I can contribute there, that might be something exciting and impactful.
Well, that's fascinating. Is there anything I forgot to ask? Um,
As always, Paul, we cover a lot of territory in a short period of time.
well, that's fantastic. Thank you so much and good luck. And let's totally stay in touch about all of this, especially I think the leadership initiatives, because I think the center directors really have an opportunity to shine as leaders of the country and the national
Yes,
program.
absolutely, completely agree. Thank you. And
Thank you.
thanks for everything, Paul.
Thank you.